So we still have to make arrangements for a funeral. We sign the consent form, and here's a copy of the consent form that we use at Pet Central. Years ago, we never had consent forms, but nowadays we have to be absolutely sure that everything is done correct. And we don't want somebody to come back and say a month or two later, why did you kill my dog? I didn't give you permission to kill your dog. So somebody has to accept responsibility for this decision. If pet parents are going to be present, you have to wait for the vet to come, and the vet will explain the procedure. Every time in my career that I've performed the euthanasia, I always make sure the owner knows exactly what is going to happen. Because once you start the euthanasia, there's no coming back. Now, normally the veterinary assistant will have explained this, but I think it's a responsibility of the veterinary surgeon just to go over this once again. When the client's ready, the owners will either stay or they will leave. And then what we do is we clip a vein over the front of the leg. It can be a hind leg, it can be some other places as well. And then a little catheter is usually put into the vein, or it can just be a needle and a syringe. It depends on the situation. And a drug is injected into the vein. The animal goes to sleep. It looks like it's sleeping a few seconds later, but the animal is in a sleep. It will never wake up from again. The heart stops, and then the animal dies. Now, the breathing stops before the heart. In reality, a heart can beat for up to about 20 minutes after the breathing stops. But usually it's an irregular heart. It's not just a normal heart. And the breathing stopping is usually the sign that the drug is working. The drug that we use is a very concentrated anesthetic drug. Remember, I talked about anesthesia, an animal going to sleep for a procedure and waking up again. When we're performing a euthanasia, the drug is at least 200 times stronger than the drug to make the animal go to sleep and waking up again. And there's different combinations, and there's different types of drugs that we do use for euthanasia. And the same drugs that we use for euthanasia of a dog or a cat or a beloved pet, the same drugs are used to execute humans that perhaps are on death row in some countries, that get killed by a lethal injection. They're similar drugs. So I'm saying that because I want you to understand how important these drugs are, and how deadly they are, and how serious and what a responsibility we have for using them. Because these drugs are designed to kill. Okay. Now, in advance, I always warn people that once we say the animal is dead, some things can happen. That no matter how many times I say to a pet parent, this can happen, they get a fright. Often we can get a little amount of bleeding at the injection site. Sometimes the eyes, not sometimes, it's the usual situation for the eyes to stay open. Everybody thinks eyes should close, but eyes stay open. The reason being that the muscles around the eyes that open the eyes are stronger than the muscles that close the eyes. So it's very normal, the eyelids are open. Sometimes the animal will have a and we call it a last gasp. It's almost like the animal is having one last time, sorry, excuse me, one last chance to get some more oxygen around the body. Sometimes they can howl or even scream, make some other noises. It's not common, but it can happen. It doesn't mean they're in pain. I can't be sure for that. I can only tell you my experiences as being a veterinary surgeon. I do not think they are in pain, but sometimes they can make a noise. It's very common to see twitching and muscles moving back and forwards. It's very common to see the tail lifting up. It's very, very common that the contents of the bowel and the bladder will be released onto the table. And sometimes we get what we call a slightly delayed death. And this tends to be in an older animal that perhaps has been fighting with a bad heart or bad lungs for some time. And it just takes a little bit longer for the body to say, oh, that's it, guys, and bye-bye. We call it a slightly delayed death. And then sometimes it can be difficult to actually find one of those veins I've talked about, because perhaps there is not very good veins because their heart's not working well, or very small animals, or the animal is dehydrated. There's not enough blood pumping around the body. So there are other recognized legal options on how we can euthanize an animal. And we can use similar drugs and just inject them into the abdominal cavity. It may take a little longer. It's a little slower for them actually to go into the sleep and then the death mode. With some very small animals, we can use an overdoses of just an inhalation drug, a gas, we can watch and monitor a small rodent, for example, going to sleep and then being euthanized. And in that situation, we would always want to make absolutely sure the animal really was dead, even though we couldn't hear a heart or we couldn't see any breathing. And in these situations, we would still inject some of the anesthetic drugs used into the internal organs of that animal. Here's a picture. This is Dr. Dave from our clinic, and he's not performing a euthanasia. I just put the picture in again to show you a common vein that we use on the foreleg for an animal. I showed you this picture earlier. This was this bulldog. Remember the brindle and white bulldog? Dr. Dave's taking a blood sample from this animal, but that is exactly the place most dogs, if they had to be injected for euthanasia, would get the injection. Now, after this happens, sometimes the owner wants to stay. Sometimes they don't. Sometimes they just want to rush out the door. But that's why we never do this last thing at night when all you guys, when all the veterinary assistants and the vets are ready to rush out the door because they've been doing a long, they've had a long, hard working day. And it's hard to push people out the door when they're leaving their pet. Sometimes people want to take their pet home. They may want to take it home overnight. And in these situations, number 16, discussing the handling of the pet comes into play because in Hong Kong, most animals are cremated after death. And the cremation companies will come to the home or to the veterinary hospital to pick up your pet. So it's quite common for people to want to take the dog home, have some quiet, peaceful time at home with their pet, and then allow the cremation company to take the pet. But the most important thing is, if the pet stays in the hospital with you, is that the deceased pet should be treated as it's alive. until it is put into a freezer. So in other words, we have the utmost respect for the body of the animal until we can let go when we know it's going into be frozen. Okay. After euthanasia, burial is hard in Hong Kong. I don't believe there is a burial site for pets, although I know that one of the islands of Hong Kong was talked about becoming a burial site for pets. But in many other countries, burials are very, very common. Sometimes pets are mounted or stuffed. So if you've ever been to a zoo, or not a zoo, I'm sorry, a museum, and you see the big animals, these are usually stuffed or mounted on their skins are taken off and they're put on metal or something like that. And some people actually do mount their pets. It's not common. I've never mounted any of my pets. I don't really, never even thought about it, but some people do. Nowadays, it's very, very common to get a necklace made from some hair or cut off from a pet. And this happens for humans as well now. I know some people who go around with a necklace, a diamond on, and the diamond has come from their mother. So some people do that. And a religious ceremony is, again, quite common, especially in Asian countries, and especially when in the Buddhist religion. Aftercare is exactly what I'm talking about when the animal leaves your possession. And the company that does this for you, it's very, very important because they have to sign for it. And then the responsibility for the dead pet becomes the responsibility of the aftercare or the cremation company. A few years ago, there was a terrible story in Hong Kong. I don't know if any of you ever came across it, but there was a aftercare, a cremation company. They picked up the body of a collie dog in Happy Valley in Hong Kong, and they were filmed throwing the body of the collie dog into a rubbish container in Kwun Tong. Now, can you imagine the owner of that collie dog? It was in the newspapers. It almost ruined the company. It was obviously just one person involved in this company or two people. But anyway, it was a terrible situation. So you have to make sure you deal with a reliable aftercare company who knows exactly what you want for your pet. And a lot of the pets nowadays, they use the microchips to make sure that the pet that's been deceased, that's been passed on, will be the same pet that is cremated if you go along to attend a cremation. It may sound a little crazy, but if you've got a small brown Pomeranian type dog, once it's been frozen for 2 weeks in a freezer and then unfrozen for a cremation, it's not easy unless you've got some distinct marks on the pet. You know exactly about the teeth or the color of a certain patch of the body. It's very easy for two pets to look alike. Okay, we've got different features, you know, we've got different hair colors and that, but animals tend not to be so many differences. So the message there is the aftercare company has to be legitimate. You've got to trust them and you've got to know what they're doing. So we want to send the body to the correct company, get a receipt for it, and most important, handle that pet with respect at all times.